You're listening to Villanova Health Summit on ReachMD. Here's your host, Dr. Brian McDonough.
Hi, I'm Dr. Brian McDonough. Welcome to what has just been the Villanovans in Healthcare event. People are wrapping it up. We just had a great panel discussion. I'm with one of the panelists now, Dr. Chris Spagnuola. We're going to talk a little bit about our topic, which was the computerization of healthcare. Are patients better off? And I think the thing, Chris, that came across was you're a true practicing physician, and I could tell just by listening to you, because you talked about the strengths, the frustrations, and also what it meant to your patients. So let's start with the downside. What are some of the frustrations with electronic health records that you see?
Thanks for having me this evening. It was a great talk. So one of the downsides is sometimes the patients get the backside of my head more than the front side of my body, because we have to spend a lot of time entering data in the computer, typing data in so we can have it, get it out to other providers, and it takes away some of the personal interaction between a patient and a doctor. And once you can get over that, there are a lot of benefits to computerization.
Let's talk about some of it. What are some of the things you've seen as an orthopedic surgeon in your practice?
One of the biggest things in orthopedics is we deal with a lot of people in pain. When people are in pain, they need narcotic medication. And as we all know about the epidemic in narcotics, there's been a lot of abuse in the past. And now with electronic medical records, we can track who's receiving what medications from what doctors, what podiatrists, what dentists across the board. They can't pay for cash at a pharmacy in CVS and I not know they had a prescription last week. It prevents overdose, it prevents addictions, it helps us stay ahead of the game instead of behind it. It's been one of the big benefits that we've seen in prescription medication.
One of the limitations of a panel is its strength. You have a lot of people and we talk about a lot of things, but everybody gets to say one or two things. Was there something on the panel that you wanted to bring up that you thought was really important that you wanted to share, because we have the audience now as well?
One of the things I think we're in the biggest takeoff was, and I think they talked about it early on, we didn't get into it, is the future of telemedicine. Not only for going to the doctor for common colds and getting antibiotics without waiting 2 hours in the emergency room or an urgent care center, but in orthopedics, there's a lot we can do by telemedicine. And what we're starting to see in post-operative rehabilitation with certain internet connections and applications, I can get feedback from physical therapists, pictures of the patients, the wounds, their range of motion, things I need to know post-operatively, and limit the amount of time they have to spend in the office, and they can get treatment from home, which diminishes healthcare costs. It keeps me in touch that if there is a problem, they can come right back in sooner. And I think it will facilitate the patient's own involvement in their healthcare and give us better outcomes in the future.
Well, it's great. Thanks you very much for joining us, and again, for being on the panel and also joining us now. I appreciate it, Chris.
Thanks for having me. It was a great night.
You've been listening to Villanova Health Summit. To access other episodes in this series, visit reachmd.com/Villanova, where you can be part of the knowledge.